Welcome to WIC's Virtual Nutrition Education. This lesson is about food allergies. A food allergy is different from a food intolerance. Let's begin by talking about what defines a food allergy. The job of the body's immune system is to identify and destroy germs such as bacteria or viruses that make you sick. Food allergy happens when your immune system overreacts to a harmless food protein, an allergen. Food allergy may occur in response to any food, and some people are allergic to more than one food. Food allergies may start in childhood or as an adult. All food allergies have one thing in common: they are potentially life-threatening. Always take food allergies and the people who live with them very seriously. Signs and symptoms of a food allergy can be unpredictable and range from mild to severe. Mild food allergy reactions might involve only a few hives or minor abdominal pain, though some food allergy reactions progress to severe anaphylaxis, causing low blood pressure and a loss of consciousness. Family history appears to play a role whether someone develops a food allergy. If you have other kinds of allergic reactions like eczema or hay fever, you are at greater risk of a food allergy. Food allergy symptoms overlap with symptoms of other medical conditions. It is therefore important to have your food allergy confirmed by an appropriate evaluation with an allergist. Next, let's define a food intolerance. Physical reactions to certain foods are common, but most are caused by a food intolerance rather than a food allergy. A food intolerance can cause some of the same signs and symptoms as a food allergy, so people often confuse the two. Food intolerance symptoms are generally less serious and often limited to digestive problems. If you have a food intolerance, you may be able to eat small amounts of the offending food without trouble. You may also be able to prevent a reaction. For example, if you have lactose intolerance, you may be able to drink lactose-free milk or take lactase enzyme pills to aid in digestion. Causes of food intolerance include the absence of an enzyme needed to fully digest a food, such as a lactose intolerance, irritable bowel syndrome, which is a chronic condition to cause cramping, constipation, and diarrhea, sensitivity to food additives. For example, sulfites used to preserve dried fruit, canned goods, and wine can trigger asthma attacks in sensitive people. Recurring stress or psychological factors can cause a food intolerance. Sometimes the mere thought of a food can make you sick. This reason is not fully understood. Another cause is celiac disease. Celiac disease has some features of a true food allergy because it involves the immune system. Symptoms often include gastrointestinal issues as well as those unrelated to digestive systems such as joint pain and headaches. However, people with celiac disease are not at risk of anaphylaxis. If you have a reaction after eating a particular food, see your doctor to determine whether you have a food intolerance or a food allergy. Now that we know the difference between a food allergy and a food intolerance, let's talk about the 8 most common food allergies. The 8 most common food allergies include an allergy to milk, eggs, peanuts, tree nuts, soy, wheat, fish, and shellfish. It can be nerve-wracking to introduce these foods to your children for the first time, so let's talk about how to introduce them best. WIC recommends waiting until around 6 months of age or when your child is showing readiness signs to start feeding complementary foods. So introducing allergenic foods soon after starting your solid food journey is important. Check with your pediatrician before introducing allergenic foods, especially if your child has high allergic risks, such as they have eczema. Introduce allergenic foods when the baby will be awake for a few hours so you can monitor them for a reaction. Offer each food at least 2 to 3 times away from other new allergenic foods so you can distinguish which food is causing a reaction. If the baby develops hives, a rash, vomiting, swelling of the face, tongue, or limbs, or difficulty breathing, call your doctor immediately. Next, let's discuss some things to keep in mind as caretakers. For children with food allergies, providing a safe and nurturing environment at a child care center, daycare, or preschool requires planning and effort on the part of the school and the parents. The CDC created voluntary guidelines to help schools manage children with food allergies. Use appropriate hand washing procedures that emphasize the use of soap and water. Learn how to read food labels and make sure everyone in the family can too. Look for allergens in the food ingredient list and/or warnings that the facility makes other products with allergens. Separate safe and unsafe foods, assign specific shelves in the pantry and refrigerator, and store all foods in sealed containers. Have separate sets of utensils for handling safe and unsafe foods. Some families even use separate dishes, designated by different colors, for foods with allergens. Scrub down counters and tables after you prepare food and after you eat meals. To effectively remove food protein from surfaces, wash the surfaces with soap and water. If you or your child have a food allergy, it's not the end of the world. There are plenty of substitutions that can be used in place of the allergenic food. A substitution for a milk allergy would be nut milks, oat milk, rice milk, or soy milk. For eggs, you can use applesauce or bananas when making recipes. For fish and shellfish, you can use alternative protein options like chicken, pork, beef, or tofu. For tree nuts and peanuts, you can use other nut butters like sunflower butter, cashew or almond butter instead of peanut butter, and you can use alternate cooking oils like avocado or olive oil instead of peanut oil. For wheat, you can look for gluten-free items such as rice or oats, or corn tortillas instead of flour tortillas. To conclude this lesson, let's talk through a short lesson recap. A food allergy is different from a food intolerance, and it can be much more serious. It involves a reaction or an immune response. Food allergies should be confirmed by an evaluation with an allergist. Safely introduce common allergenic foods after the age of 6 months old. Introduce them one at a time, giving them 2 to 3 times each to ensure there is no allergic reaction. Lastly, be sure to communicate allergies with other caretakers. Ensure that everyone knows how to read nutrition food labels to look for common allergens, and make sure your child knows what they are allergic to as well so that they can share this information with those they are around. Now that you have finished watching this nutrition education video, please return to your email and complete the Google survey that is attached. Thanks for watching!